Hi, I'm Dr. Robert Berry, and we're going to learn just a little bit about LASIK, L-A-S-I-K, laser-assisted in situ keratomileusis. That's where you literally put your glass prescription on your cornea. It's a very common operation these days. Several million of them are done in the United States every year. It's got most of the bugs worked out of it, but it's still an operation. There are still complications that can occur, and they still do occur. So it's not an operation to be taken lightly. Here's how it goes. The cornea itself is about 1/50th of an inch thick, but it's very strong tissue. It's like leather. If you have a whole globe in your hand, just squeeze it. You can't pop it with hand strength. It's that strong. And the curvature of your cornea has a lot to do with how well you see. If it's too steeply curved, you're nearsighted. If it's too flat, you're farsighted. And if it's warped, you have astigmatism. With LASIK, what you do is make a little incision, part of that depth, of that 1/50th of an inch depth, maybe a fifth of it, a hundredth of an inch or less. And you make a flap hinged on one side, and you raise that flap. Now you can make that little incision either with a mechanical blade or with an excimer laser. There are two ways to do it. You raise the flap, and then you laser, you evaporate. The word is ablate, but literally think of it as evaporation. You can evaporate some of the tissue on the subsurface under this flap. Then you hide that whole surgery by putting the flap back. It's pretty comfortable. The only place the eye feels anything is right around the edge, and after a few minutes to a few hours to overnight, that's grown over with skin, and it feels like a normal eye. But you basically have changed the curvature of the cornea. You can steepen it if you're farsighted. You can flatten it if you're nearsighted. And in doing so, you put the prescription on the eye. The descriptive term I use for patients is, we're going to carve your prescription on your cornea and it'll stay there permanently. Now, your prescription can drift over the years just like it does for anybody. LASIK puts you in a zero balance or close to it at one point in your life. It can shift over the years. It can be adjusted. It has to be evaluated on an individual basis. But LASIK is basically raise a flap, alter the surface, put the flap back down to hide the surgery and to make the eye much more comfortable.